Hi, my name is Pam Dunwald. I'm one of your nurse advocates from our company, Your Nurse Advocates Consulting. And today I wanted to talk about a topic that people ask us some questions about. They're not sure what it is or how it impacts them. And that's the illness called sepsis. We've just finished up the National Sepsis Awareness Week. And I just wanted to take a few minutes to be able to go over and answer some of your questions. Some of the things that is really important to know is, first of all, what is sepsis? Well, sepsis is when an infection such as a urinary tract infection or pneumonia, or it could be something like influenza or even COVID, starts an infection in you, and then it spreads to your blood and it spreads to your body. So some people might refer it to like blood poisoning, but it is an infection that has now invaded your entire body, and it can become very serious. According to the Center of Disease Control, at least 1.7 million adults in America develop sepsis. And then out of that, 350,000 adults who develop sepsis die during their hospitalization or are discharged to hospice. 1 in 3 people who die in the hospital had sepsis during that hospitalization. Sepsis or the infection causing sepsis starts before a patient goes to the hospital in nearly 87% of the cases. So that's pretty significant. And so a lot of people are hesitant to go to the hospital. And so what are some of the symptoms? Let's look at that real quick. What are some of the things that you're going to see when you are possibly dealing with something like sepsis? So what we're going to see is more likely we're going to see fever. Could be a high fever such as 101 or over, or anything over, 100.3, 100.6. Anytime you're getting over that 100.3 range, that temperature could be significant. You're looking at other symptoms such as chills. Your heart rate will beat faster. That could have a couple of different reasons, and we won't get into all those specifics, but abdominal pain, just you're breathing really fast, or you can't catch your breath. You might have dizziness or slurred speech. You feel very fuzzy in the head, lightheadedness, you may be disorientated. You're dizzy when you get up, which could be a sign you're having low blood pressure. You have extreme fatigue, muscle aches, nausea, vomiting, even chest pressure, pale, decreased urination. You can also have some sweaty and clammy skin. And, the downside of this is we want you to get treatment early. We want to avoid septic shock. And, I know those are a lot of symptoms to have to, sort through because, with sepsis starts with an infection, usually somewhere else. So you may have, for example, even if you have chronic obstructive lung disease or COPD, you might be used to having some of those lung symptoms because that's kind of a normal occurrence for you, and you get some exacerbations or flare-ups, but that can also turn into sepsis. So we just need to be really cognizant. If you get ill and you're not getting better in a couple of days and you seem to be getting worse, that definitely is a phone call to the clinic. Or if you can't get in to see the clinic, always, know that you can go to the emergency room. Some people say, is there a way to prevent, sepsis? Well, the best way to prevent sepsis is to try and prevent yourself from being ill. So again, good hand washing habits, using, hand washing with soap and water, avoiding contact with people that are sick, getting your regular checkups. If you're an elderly person, you do have that once a year annual Medicare exam that covers everything. So please get in and schedule that. Even vaccines, you've got the pneumonia vaccine, the influenza vaccine, other vaccines that your provider may be recommending for you to help keep you from becoming ill. So who might be more prone or more susceptible to sepsis? Well, people with chronic diseases, people over the age of 65, or young children, babies under the age of 1. This is important. So it's, as an adult child of an aging parent or grandparent, it's really, really important to make sure that you're keeping track of when they're not feeling well and making sure that medical treatment is completed in a timely manner. One of the things, I don't want to scare anyone, but I mean, my point is to really hit home, how important it is to identify sepsis at an early stage, because it's a serious medical, condition. And we talked about how, how many millions of people worldwide that this affects. But so what it is when you get this big infection that takes over your body, it triggers what they call a systemic, or systemic would mean like throughout your whole body, an inflammatory response. And this is your body's like kicking into, flight or fight. I mean, it's in survival mode when this happens. And so this could lead to organ failure, including heart failure, your lungs, your kidneys, brain, skin. It could lead to tissue damage and even loss of limb and death. And the reason why, we had a friend of ours, he's another advocate, and he is an attorney in the Midwest area. And years ago, they didn't catch his sepsis, and he lost part of his arms. He lost part of both of his legs, because when your body is in that fight or flight mode, that your circulation, you're trying to get oxygen, get blood to all those major organs. And so what it does is it has to pull away from your extremities, which is your arms and your legs, to try and preserve the function of your vital organs. So it could cause a lack of circulation. And so, if when your tissues don't get enough oxygen, enough blood, well, they can get necrotic and they can, get gangrenous. I mean, it's just a whole nasty outcome. And so you just want to make sure that you jump on that frequently, and over the years, the hospitals, they have put some, good things in place. I mean, there's criteria they follow. So there's algorithms when someone comes into the emergency room or someone comes into the hospital, they're looking at your heart rate, they're looking at your fever, they're looking at certain blood tests, they're looking at all of your vital signs. And there are ranges and things that we look at to see if you are quote unquote meeting some of that criteria. And so one of the first things that will happen is they will start to give you a good amount of fluids. And it's hard, because the doctors, they need to weigh, if you have congestive heart failure or other illnesses, sometimes giving you large amounts of fluids to fight the sepsis can also put your heart failure in overload. So this is just a very, very serious thing that the doctors need to treat and weigh all the options and the risks and benefits. So the bottom line in concluding this is that just make sure that, if you've been sick and all of a sudden maybe you've gotten better and then all of a sudden get worse again, this could be a sign of something else and maybe something more serious going on. We hope this has been of value to you. Again, I don't want to scare anyone, but this is something that the more that all of you, consumers out there are educated and are aware of these things, the more you can advocate for yourself and also advocate for your family. So don't hesitate as us for Your Nurse Advocates. We've got a couple of things that we've got our Facebook community. It's called Speak Out on Caring for the Aging Parents. That is a private Facebook community where we get into the weeds and we discuss live chats. We have guest speakers, people coming in to help support and educate and give you plans to help care for your aging parent or grandparent. We also have a free checklist called 11 Signs Your Aging Parent May Need Help in the Home. That is actually your beginning stage one. If you're just getting involved in starting to help manage the care of your aging parents, that's a really good tool to just kind of an overview of a lot of the home, what they're doing, how they're caring for things and being able to take care of themselves. It's broken up into 4 sections. And it's a really nice checklist to give you, that beginning starting point for you to start looking at what cares or what help, your aging parents may need help in the home. So we're glad you stopped by. If you have any questions, please drop us a comment. We'd be very happy to get your questions answered for you. And we'll see you in the next video. Take care.